Welcome to this tutorial entitled Which AED is Right for Your Office. My name is Brian Oglander with Southwest Oral Surgery, and what we want to accomplish here is if you've decided to get an AED for your office, we're going to see if we can help give you a little information and guide you as far as what you may purchase. At least so you make a more informed decision. A couple things about the AED. First of all, AED usage is a required learned event for Missouri licensure renewal. The Missouri Dental Board requires us to take a CPR class as well as a class that includes how to use a public access defibrillator. So obviously the Missouri Dental Board thinks it's very important. Most likely the lay public will expect us to manage sudden cardiac arrest if it were to occur in our office, not necessarily where we're in our treatment area, but perhaps in the waiting area. Certainly the research supports the evidence that immediate defibrillation is important for sudden out-of-hospital cardiac arrest. Most AEDs are biphasic. That means they deliver their energy in two vectors. If you look at this diagram right here, remember when we put pads on a patient, we're using two pads, one over the right shoulder, one underneath the left armpit. So when a shock is delivered, that energy goes from left to right pad and right to left pad. So we're getting energy in two vectors, less energy is needed, and it's more effective this way. The percentage of success with the first shock occurs in about 90% of biphasic defibrillators, which is much greater than the monophasic defibrillators. So just a little information. Your defibrillators are biphasic, and that's most current models now. If you look at some of the common defibrillators available that you can purchase through a dental supply company, generally what you're going to find is the cost is about median of about $1,500, and that has come down. Before about 10 years ago, the defibrillators were more around the $2,000 range. We'll see some common ones here. The AED by Zoll is about $1,600. The DefibTech over to the right of the Zoll is common defibrillator you'll find in their hospitals, and all the way to the right is the Physio Control, which is a very reliable defibrillator. It's about that median, about $1,600 as well. Cost of ownership for the AEDs. The pads themselves generally need to be replaced every 2 years. That's because the adhesive agent they is used to keep the electrode in contact with the skin that can degrade with some time. So usually those need to be replaced every couple of years, as well as the battery for most of these defibrillators. They're usually a lithium-ion battery, so they'll last long, but after about 2 years, the battery generally needs to be replaced. Usually there is a date which tells you when the battery needs to be replaced. There are some less expensive AEDs out there that operate with your batteries that you would find and purchase over the counter. It's good and bad. Your cost is much less. However, if you put your defibrillator away in a corner and never look at it again, pull it out in 5 years when you need it, your batteries may not be working. As well as the cost of ownership here, we've got the same defibrillators available, and you'll see that the pads themselves range anywhere from about $38 all the way up to $120. A couple interesting things. The defibrillator companies, some of them say, for instance, the Zoll here right in the middle, the pads are about $170, but they're not replaced except every 5 years, so you get a pretty decent length of time out of them. The battery's replaced every 5 years as well, so that's about $35, so not too bad. You don't have to worry about changing things very often. You can go over to the DefibTech where the pads are much less, but they're replaced every 2 years, and the battery's replaced every 5 years. So there are some differences amongst the defibrillators. When you're looking at them, you may want to look at that as far as your cost of ownership. Other things to look at, some of the defibrillators that are available will walk you through CPR. So if you needed to use this, it would go through the whole CPR algorithm, give you some audio cues just so you don't get lost while you're working. Some of the defibrillators will analyze quicker than others. Some defibrillators are fully automated. In other words, they would shock for you. If you were to put the pads on the patient, the machine would go ahead and analyze, and if shock is needed, it would go ahead and discharge a shock once the patient was cleared. You wouldn't have to push a shock button. As well as some of the defibrillators give you feedback on quality of CPR, which is important. If you felt like maybe my CPR was inadequate, this defibrillator or these defibrillators would give you feedback. Other things to look at, what's the warranty and service? Self-explanatory. You just want to get an idea of what if your defibrillator is broken, would you be able to service it? The company that would service it, and how long is the warranty? Can the defibrillator be upgraded, which is important? The American Heart Association comes out with newer guidelines. You would be able to download information and upgrade your current machine versus buying a new one. Some defibrillators have trainer modes, which is good if you want to do simulation practice with your office. Some defibrillators are much smaller than others, easier to store. Some have an animation screen, which probably isn't so important for our purposes. We want to choose maybe the least expensive because that's going to do just fine for us. We just need something in the event of emergency to deliver one shock. You want to make sure your AED is in an accessible location. You want to make sure that everyone in your office at least knows where it is and has some training in how to use it, and that's where the CPR courses will come into play every couple of years. Regularly, you check the battery at least once a year, generally when you're looking at your emergency kit and making sure your drugs haven't expired. And then you want to consider practicing. It's worth it even just to make sure the staff knows where the defibrillator is, simulate a mock drill, have them bring the defibrillator out, turn it on, at least have the pads available. You don't necessarily have to put them on, but you can at least practice. Hope this helps you guide your decision making if you're going to get a defibrillator, and thanks for listening.